today. Um, it's pretty much about what we offered and also about planning and caregivers. I'm not sure if Mary or you're a caregiver, but you just said that you lost your son. I'm so sorry about that. But if you know anything about I mean, a lot of people know a little bit about caregiving because we're all caregivers, even if it's not for somebody that's ill, but it's for our parent, our friends. We can be a caregiver, a figure for anybody, right? So let me just put that on. Okay, here you go. So again, I'm Shayna Jacques. I am the outreach manager for PSS Circle of Care. PSS stands for Presbyterian Senior Services. So today we're going to talk about the top question that if you're a caregiver, you need to consider, right? So first, is it ever too early to start planning? And as of March, we know, and a lot of people had learned that it never been too early to plan because at any time something might happen, and then you will need to start recuperating information to plan for something that was not anything planned for before, right? So, what service to consider when you plan for the future? How do I handle issue with regarding ADLs? How do I deal with behavior problem? And what is self-care and where can I find support? So, like I said, is it ever too early to planning? Of course not. It's never too early to do that. So the benefit of planning ahead is first is to give the opportunity to the caregiver to be to the care receiver to be involved. So before I go too deep in the information, so I just want to just quickly say that on PSS we also offer services to caregivers. Right, caregivers who's caring for a loved one. It can be a family member, it can be a friend, it can be a neighbor, be a house, a wife caring for the husband. It's either way. So in the planning it's always good to have both people involved. So that's why when you start planning ahead, it's good to have the person that you're gonna give the care to participate in the planning. And the next one is to prevent crisis planning and caregiver burnout, because you don't want to wait at the last minute. That's when you're gonna gather all the information. At the end of the day, you're gonna be stressed. It's gonna be very stressful, and then you don't want to have the caregiver burnout coming to you, right? So I'll allow advanced education and preparation of emotion and demand, because like I said, it can be very stressful to find all the information that you need, and also at the same time, you don't want the person that you're caring for to be nervous, and then also be able to do the transition very smoothly. Avoid financial strain, and encourage family planning. So you want to have a team. You want to have other people in your side. So when planning, there's a lot of information that you need to consider, like services. For example, if somebody that you caring for, but I'm not necessarily us, but anybody that's caring for a loved one, it might need adult daycare. It might need transportation. It might need in the future some type of respite care, because especially right now, a lot of people are going back to work, or because we have been working from home for the past 4 months now. So a lot of people find themselves returning to work. So how you plan that? So, and there's a lot of services that provide respite care. So you want to plan ahead to see where can I find these services, and how can I incorporate that in my day-to-day living, and to find somebody that can come to the house and replace the time I was living with my loved one and provide the service that they need. It can be a home health services, the same thing as a respite care, just for the caregiver to find balance between their to go back to their regular life, or to just take a break because they know for the past year or they have been dealing with the service, with the caregiver situation. So now they just want to taking care of themselves, and then find the services that needed for their loved one. So first, what is self-care? So we know self-care is any activity that we can do to deliberate it. Let me just move this a little bit further up. Just give me 1 second. Oh, can I can I move this? One second. I'm just trying. Okay, here you go. Trying to move it a little bit up. Okay, so yes, so self care is any activity that we do deliberately in order to take care of ourselves, our mental, emotional, and physical health. Right? It is always good to taking care of yourself. Good self care is a key to improve mood and stress. So we all know that it's always good to taking care of yourself. And taking care of yourself is can't be selfish, because if you don't feel good, you will not be able to taking care of somebody else. So it is always important to taking care of yourself. And why is it important? So we all know about this start, like when you go to the plan, and I know a lot of you know, I mean most of you know about that. So when you're in the plan, somebody when in an emergency, what they ask you to do is just to put your mask first, because if you can taking care of yourself, you'll be able to help the person next to you, your family member that's next to you, your children, anybody that's next to you. So you need first to pay attention to yourself, and in that way you'll be able to help the next person. So it's the same thing in the self is a caregiving situation, because if you burned out, if you're very stressed out, you're not going to be able to help the next person. So that's why it's always important to pay attention to your self-care. So only when you really pay attention to you and provide service, information to you, that's where you can help the person. Caring for yourself is one of the most important thing, and one of the most often forgotten, because people always want to try to find the services for your loved one, to make sure your mom, your dad, or your husband it's well taken care of, but at the same time you're forgetting about yourself. When you need when you needs are taken care of, the person you care for will be benefited too, right? Because at the end of the day, you don't want to become sicker than the person that you taking care of. And we see that often. The person that's taking care of their loved one, usually they fell off first, because they get all this burnout, all this stress out for themselves. So, any some sign of caregiver burnout is emotional, mental, and physical exhaustion, low energy. So you don't want to do anything. You don't want to get up the bed. You don't want to participate in any activities. And I know with these time now we find ourselves more involved, because it's out of we don't have to work to where we have to participate to one-on-one services, but with the help of technology now we can participate more in some type of nutrition or wellness activities, right? So some other signs is loss of interest or isolation. Um, so let's just do a quickly different make a differences between the healthy one and the unhealthy self-care. So reading a book, now we have a lot of time to do that. um, Exercising, we can participate in exercising online. TPSS provide yoga classes, and I'm pretty sure Baywitch also provide wellness activities and exercises online. So these are the type of thing that's healthy that you can do. So something that's unhealthy to do, it's keeping everything to yourself. You always want to find somebody that's safe or somebody that you trust that you can talk to. Participate in some type of support group. It's always helpful. Um, Oversleeping, it's not good. So you find yourself now want to engage in any activities. So you want to be aware of this unhealthy self-care. So where can I find support? So I said before, you want to find somebody that close to you. You want to create a team when you want to make decision, when you want to your care the care receiver, your loved one to participate. So you can find support, family, friends, neighbor, and a lot of time. A lot of caregivers do not identify themselves as a caregiver, because they feel like this is something that they're supposed to do when it comes to a family member or my mom. This is something I'm supposed to do. That's when comes the stress. That's where it comes the burnout. So you want to encourage a lot of people to participate and providing that support to your loved one. A physician, a social worker, um, community-based organization, all this can help you. And also PSS is here also to help. So just a quick overview again about PSS. We have been founded since 1962. We are a nonprofit agency that provides services to older New Yorkers, their family and community to thrive. So we provide a lot of educational training, mainly online now. They all designed to help older adults to stay healthy, engaged, and connected in the community. So we also do have now it's 10 senior centers that we do have. Most of them are in the Bronx and Upper Manhattan. They also provide um, educational training. They also provide online services right now. We do also provide meal plan. So now, since we cannot be together, we cannot provide it in the senior center. So we send them to the house. So we do called where the members can come and pick up their food, or the one that cannot pick up the food. So we send them to their house. So the service of PSS Circle of Care ensure the people that's caring for someone who's frail, chronically ill, has a memory loss issues. We provide services to them. So not recently, but now it's been 5 years now. So we were granted a grant to provide services to older adult, especially those who's caring for loved ones who has any type of memory loss issues. Our services were mainly in the Upper Manhattan and the Bronx, but since we did receive the grant, so we were able to expand to all 5 boroughs. So something that not mentioned, our services is completely free. We do not ask about anything. The service it's provide to anybody. We do not ask for financial information. We do not ask about immigration information. It's just because it's a grant, so we can help the family members. And also, based of the caregivers, a lot of people tends to think caregivers can only be older adult. Caregiver can be anybody. I'm a caregiver myself. I'm a caregiver for my mom. So it can be a neighbor, it can be a friend, it can be your pastor. So anybody can be a caregiver. So we want to emphasize of that, and then let people know that there's help and that we can offer it. So PSS Circle of Care offer at no charge. So when we do identify somebody that needs the help, so we'll provide a care coordination. There will be a social worker assigned to the family, where they will go over an assessment and see what are their need and services that they need for their loved ones. Individual and family consultation is provided by the social worker that's assigned to the family. Like I said earlier, we do have support group and a variety of educational training. Also wellness activities. One of the main service is the respite part, where we can offer a home care agency to send a home health attendant to their house free of charge, to help the caregiver just to take a break, like if they have to make a plan to go back to work, or just for them to go back to their own doctor's appointment. So we can do that. It's temporarily, but of course we can provide that free of charge. Any question? So just quickly, I want to share our website also. So where we have a list of services and resources in our website. So most of the webinar we have been doing, we also record them. And then if you want any of information, you can just go to our website. Let me just move this on that side. And you will see all the past webinar that we had. Here you go. So we have elder representation. We have a stress reduction workshop that we have for 5 weeks. We also had research study that has been done. Like I said, we have a variety of a lot of events. And if you want to just register to them, you can just go pssusa.org/resources or /event. It will bring you to this, and you will see all the lists of information or event that we provide to the community, and all of them are free of charge. Any questions so far?
No, that's an awesome resource though. Thank you. So you guys record all of your webinars and that they're online for free. That's great.
Yes, they are free. You can just click and register to them. Some of them are like a workshop for 4 weeks or 3 weeks. We have financial information, elderly information, Medicaid, power of attorney, all a variety of information online. So
Yeah.
definitely, you can share it if one day you want to partner and then just have it stream for your members. We can do that.
Awesome. Thank you. That's very useful information.
So that's pretty much what I wanted to share with you today. If you have any question, if you know of anybody that's need of services from PSS, please let me know. And I know it has been very stressful to a lot of people right now. And then just to know there's help and then there's free service that you can reach out to. Yes, please do so. And we have a list of like resources that people might need. If you need that, you can just reach out to me.
That's awesome. I'll be sure to pass that along.